Hi, I'm Dr. Brenda Ross, and I am a maternal fetal medicine specialist with UCR Health. So most of the patients I see are women who have medical complications that would complicate their pregnancies. Some of them are issues like diabetes or hypertension. Some of them are more complicated issues like multiple sclerosis or lupus. A lot of the patients that we see are women who are diabetic prior to becoming pregnant, or women who develop gestational diabetes. And those are two issues that are kind of close to home for me because they complicate pregnancies carried by women of color a little bit more frequently than other populations. And those are things that we can directly impact by making sure patients are well educated about things that they can do to enhance their pregnancy outcome. Well, it's important to know that if you conceive while you have diabetes, it's very important that your blood sugars are well controlled at the time of conception. Having uncontrolled diabetes dramatically increases the risk of birth defects for the baby. It can be things as relatively straightforward as having a small hole in the heart, or things that are much more complicated like having complex congenital heart disease that requires surgery. One of the things that's important is to plan your pregnancies. So a lot of patients, many of the patients that we see are pregnant in their unplanned pregnancies, which of course is fine also. But planning a pregnancy allows you an opportunity to optimize your health care prior to becoming pregnant, making sure that your hemoglobin A1C is well controlled, that you see your primary care doctor, and that if you have any renal disease or kidney disease as a consequence of your diabetes, that's well controlled prior to conceiving. Working to keep your blood sugars down is our primary goal. We can tackle that with exercise, of course with diet. The fewer carbs you eat, the less sugar you eat, then the lower your blood sugars will likely be. But if we can't control it with diet and exercise, then we move on to medication. So coming in with all of your enthusiasm and all of your questions and feeling free to ask me or the staff anything that you're uncomfortable with is critical. So one of our primary goals is to make sure that our patients are well educated